Well, when someone is told that he has Parkinson's disease, it means that one of his brain motor system is affected. And this motor system affects the fluidity of the movement. So characteristically, the person becomes slow and stiff, and to some extent stability will be affected. There is also a very prominent shaking, which often is in the hands but can occur in the chin, can occur in the legs. So Parkinson's disease does affect a person in quite a, I would say, negative way in his mobility and his movement. Of course, also the facial expressions, the body movement, the gait, the walking will be affected. Well, fortunately, since the 1970s, with better understanding of the chemical mechanism of Parkinson's, where there is a shortage of a chemical called dopamine in the brain, many new drugs have been discovered. And with these new drugs, one is able to improve that aspect that is deficit, the difficulty in moving, the difficulty in coordination of his daily activities. All that can be improved with medication. There's a wide range of medications that can be used. But like all medications, we have to use it carefully because it has its risks, it has its side effects, and unless it is used carefully and judiciously, the side effects can appear very soon as 3 to 4 years. Yeah. Yes, as you know, because the problem affects one's movement and one's coordination, there is a very high risk of falling down. So the setup in the house, especially living in one floor, just ground level, and the facilities from the bed to the toilet and around the vicinity of the home, the sitting room, all have to be adjusted. For example, getting up from a low chair can be a great difficulty. Getting up from a toilet bowl can be very difficult, and also taking a certain step suddenly might result in a fall. So definitely there can be adjustments so that the home is friendly towards this elderly person, who in any case, you know, any elderly person would have the risk of falling. As you know, in Western medicine, our focus on diet is not so strong. But what we know is a high protein diet can affect the medication. So as a general rule, there are no strict restrictions to diet. But of course, a healthy lifestyle, healthy eating habits would help prevent other diseases like stroke and heart attack. Parkinson's, as you may know, is a condition that will drag on for 20 to 30 years. So during that time, if one is not careful with diet, one may succumb to stroke and heart attack. So there are cases of Parkinson's disease who also have heart attack and stroke, and that would be quite a tragedy for that same patient. Okay, the first level of therapy still has to be medication that will boost up the person's mobility. But on top of that, exercise, physical therapy of various forms, whether the traditional physical therapy associated with massage and acupuncture and reflexology, these all help a lot. There are various exercises, I believe, like Qi Gong, Tai Chi, Wai Tang Gong, which can contribute. It's almost like a normal person with active physical activity, they improve. So what more with someone who is not well? Why not we push ahead? And I believe through that, physical therapy and various form of activity, for example, cycling has been found to be very beneficial. Cycling either on a stationary bicycle or on a moving bicycle, we find that actually the patients can recover. One little test is to throw a ball at a patient with Parkinson's, and you'll be surprised their reflexes are just as good as any other person. So definitely physical therapy is important.